wajen samar da kayayyaki ga kwastomominku. Ku cika alkawarin da kuka ɗauka wa kwastomominku. Ku faɗi gaskiya kuma ku gyara lamuranku. FCCPC na sa ido. Kowane ɗan kasuwa ya kamata ya yi kasuwanci cikin adalci da kuma cika abin da ya alkawari wa kwastomominsa.
Afternoon and welcome to another edition of the program Your Money, Your Right, brought to you by the Bauchi State Television with support from the Northeast Zonal Office of the Federal Competition and Consumer Protection Commission, FCCPC. Our focus today is on the Patient's Bill of Rights. You'll be wondering why the Federal Competition and Consumer Protection Commission is discussing issue of Patient's Bill of Rights. Everyone, in one way or the other, uses healthcare services. So stay tuned with BATV as we examine the key rights every patient needs to know, how you can seek redress when your rights are violated, and many more concerning the Patient's Bill of Rights. I'm being joined in the studio to discuss this by the Consumer and Business Education Officer of the Northeast Zonal Office with headquarters in Bauchi in the person of Mr. Abochi Stephen. You are welcome to BATV.
Thank you. Good afternoon, ma'am.
Yeah, good afternoon. Before we continue, Patient's Bill of Rights, what does this Patient Bill of Rights actually talks about?
The Patient Bill of Rights is a document that protects patients by stating their rights. So that's all about the Patient Bill of Rights. The document protects patients by stating their rights, and it's not just designed by FCCPC alone. The Patient Bill of Rights was designed and written in 2017 by the then Consumer Protection Council, alongside the Federal Ministry of Health, Nigerian Medical and Dental Council, was spearheaded by the Nigerian Medical Association. So looking at the Constitution of Nigeria, the Nigerian Medical Act, then the FCCPA, they brought out these rights of patients so that to be pronounced and easy to access, so that patients get to know their right each time they walk into the hospital.
So why is it important for a patient to know his or her rights? Why?
Well, it's important for a patient to know his or her right because the doctor is trained to treat you when you are sick. But you have the right to know what is wrong with you. You have the right to know what is being given to you.
So that's why it is very important. So can you explain for the layman to understand, and patients out there who day in, day out, they are trooping to various health facilities, be it primary, secondary, or tertiary health facilities to seek services. So can you explain some of the key rights that a patient need to know while visiting a health facility?
Okay, thank you. We have key rights patient needs to know. First of all, we'll talk about the right to relevant information about your health. As a health seeker, as a patient, you have the right to relevant information about your health. Starting from what exactly is wrong with you. First, you go to hospital, doctor check you, get to tell you what is wrong with you. And when they are giving you medications, all these things are still under the information. What exactly are you giving me? The treatment. How does it work? What is the positive effect? What is the negative effect? And this must be done in a layman understanding. If I'm having typhoid, tell me I'm having a typhoid, I will understand. But if you tell me I'm having Salmonella typhi, I will not understand. So it has to be given to me in a layman language that I will understand. I'm going to give you 2 stories of my personal experiences. My senior colleague then, which is a medical doctor, Dr. Fayomi, he takes care of me and my family medical-wise. I think he has more than 15 years of practice. My daughter was sick and I called him one day. I said, oh, my daughter is sick. He demanded for a video. He checked and he prescribed a particular medication. He told me the positive effect of the medication and even told me down to the negative effect. He said, if you keep this particular medication in your bedroom, it smells. Are you okay with the odor?
Mm-hmm.
So you see, he told me everything. So the relevant information, you need to get all the information down to the side effect of the medication. Then I had another experience. I don't usually go for herbal medication. But a few years ago, I was sick, keep treating malaria and typhoid.
Yeah.
Then one day I was passing, I saw a very packaged herbal office. I went and I told the guy, I'm sick, this one. He just said, oh, I need to flush my system. He just missed some things for me inside Sprite and said I should take. I took it, no question asked, nothing, no relevant information provided.
Yeah.
So while I was about leaving, he demanded for my phone number. I said, what happened? He said, give me your number, sir. I gave him my number.
Mm-hmm.
I went to him. I was surprised, like 1 hour later, he now called me. I was like, how are you, sir? I said, I'm fine. He said, I'm the one that gave you medication. I said, I'm fine. He said, are you sure you are fine? I told him, yes, I'm fine. Any problem? He said, no problem. So like 15 minutes later, I started having running stomach.
Okay.
And I started frequenting the bathroom.
Yeah.
I now called him. The first thing he said when he picked my call, in a Pidgin language, he said, Oga, I hope you are calling me from the toilet. I said, how did you know? He said, I know you poach. I said, why didn't you tell me? So you see, and honestly, I've almost flushed my life with the disease I want to flush.
Mm-hmm.
What am I saying in essence? These are two different medical practitioners. One gave me information down, Dr. Fami gave me information down to the other.
Yeah.
The other person refused giving me information, and it almost ended my life. So as a health seeker, you have the right to relevant information, and the doctor need to tell you. If the doctor may be an oversight or the doctor is busy because of patients waiting for consultation, you have the right to ask, what is wrong with me? Not just, sometimes what you are trying to curtail is the fact that you need to know what is wrong with you. Sometimes you just go to hospital, they pass file from lab to the doctor. Doctor will just write.
Just prescribe
exactly,
and pass, without telling you what is
yes,
wrong with
without telling you what is wrong, and pass to the pharmacy. Pharmacy will just give you drug. When people get on, what medication are you taking? The person will tell you, I'm taking one yellow and white medication.
Yes, it's true.
You don't know so you need to ask, what's the name of this medication? So when something is wrong, somebody can say, oh, this is the problem. So you have the right, even if they don't tell you, as a health user, you need to ask for clarification.
Okay.
So that's one of the relevant information about their health.
Yeah. When you talk about relevant information, there's always a problem. When you want to ask the doctor, you know how the doctors will always react, because they'll tell you it's their job to prescribe for you, so you don't need to ask questions. So is it only the doctor or the pharmacy also need to tell you the components of the drugs you are going to take?
If you are going to the pharmacist, which I don't advise, if you are taking...
after prescription, you go to buy the drugs, and then the pharmacy can also advise.
Yes. But I think, and I know, if a doctor prescribes a drug and say, you take Amatem, take this, you have the right to ask, doctor, this medication I'm taking, what's the side effect in my system?
Yes.
How does it work? So even if the doctor is shouting, which I know most of them won't shout, is your right. Mm-hmm. So now that you are aware of it, is your right, you need to ask, doctor, please, is my right? Mm-hmm. What is the effect of this medication? How does it work? How does it react?
Okay. So apart from the right to information, what other key rights do we have?
We have right to relevant, right to access medical record.
Okay.
This right to access medical record, if you go to any hospital, you get to have a card.
Yeah.
This card has numbers. This number tallies with your file in that hospital. So let's say I'm working here in Bauchi today, and I have a file in teaching hospital with medical records, and they transfer me today from here to Abuja. A doctor there will also continue with the treatment. I have the right to go to BH to TH, follow the due procedures, not just go and stand and say, follow the due procedures and ask for your medical record, photocopied and given to you, so that you take it there for the doctor there to know your health history. Is your right?
Yeah.
Mm-hmm. So you have the right to access your medical record from the past.
Okay.
Then you have the right to transparent billing. Mm-hmm. This right, we don't ask about it much in Nigeria, but it's our right. You see somebody who is on admission for 3 days, they are discharging and they just tell you your bill is 150,000. you just collect and pay.
Yeah.
No. You have the right to bills, and not just bills, explainable bills.
Okay.
Your test is so and so. The medication is this amount. The best space is this amount. If there's any other money, additional money, it should be clearly written. So as a health seeker, you have the right to transparent billing.
Okay.
If you are billed and you don't understand this billing, ask. And you know why it's funny and why we need to ask? Sometimes the doctor might not even be aware.
Of the billing.
Yes. In quote, there might be some people in the account unit that want to be manipulative, that want to have a way of making their own money,
Okay.
and can also inflate this. So you have to ask. Along that line, you will be surprised. You get to find out some situations. You know, like Nigerian supermarket, for instance. If you go to some supermarkets and if you're not careful, they will just print out one big bill and just give you money. Maybe when you settle down and calculate, you discover something has happened. So you have the right to transparent billing.
Okay.
Okay. Then we have the right to privacy and confidentiality.
Yeah. I was going to ask that one because it's an issue also.
It's an issue, right?
Yes.
Okay. We have the right to confidentiality and privacy.
Okay.
As a health seeker, your right should be, the doctor is supposed to protect you.
Yeah.
Protect all information you've shared, because telling the doctor what is wrong with you is like sharing your personal life with that doctor. So the doctor has the right to protect all your information, protect everything you've discussed with him or her. However, there is exception to this right.
Okay. In what way?
Okay. There are legal exceptions where your health status cannot be kept private.
Okay.
For instance, let's say if there's Ebola breakout in Bauchi today, and the doctor diagnoses you and treats you of Ebola, you don't expect that doctor to keep it private. Because the moment he's keeping it private, is endangering the larger society.
Okay.
So at that point, you cease to lose this right to confidentiality and privacy.
Okay.
Let's say during COVID-19, you don't expect a doctor to treat a COVID-19 patient or after confirming this person is COVID-19 and say them privacy and confidentiality. So I will not. So there are exceptions to this law. Then maybe sometimes this one needs your approval, but it's something you have to do. Like a hospital trying to give a formal documentation and information of what they've treated you of to your health insurance company.
Okay.
Because at that point, they need to tell the company what they've treated you of, what they've given for them to get their money back.
Yeah.
But you need approval. However, for a patient's health status and medical records to be released, you need a written approval from the patient. Now, let's take the African context away.
Mm-hmm.
The fact that you are married to somebody does not give you the express right to their medical record.
So maybe that's why before they will operate you, you have to sign consent. Then your family, your husband will sign. But now it's the patient that signs the consent.
Patient
so maybe they're also
and
abiding by that.
The family sign. But let's say some people, for instance, want to die a peaceful death.
Mm-hmm.
Like this relevant information. You know, if you're watching movies from the Western one, you see when somebody say, the doctor told me I have 3 months to live.
Yes.
In such situation, the person can say, don't tell my wife and my children. I want to die a peaceful death. Let me prepare my family. Let me prepare my will.
Okay.
So it doesn't give you the right because the person has a wife and you go and tell the wife, your husband is dying in 3 months' time.
Okay.
So the person is entitled to his or her privacy and confidentiality.
Okay. Yeah. It's very interesting talking about this rights. There are a lot of rights that a patient we hardly understand. Even us who even claim to be educated, there are things we don't understand. So apart from this, it's like you have a list of many rights that we need to know. Let's continue with the conversation.
Okay. You have the right to clean, safe, secure healthcare environment.
Yeah.
Clean, safe, and secure health environment.
Okay.
So if you go to a hospital, it's your right to ask the hospital management, this my place is too dirty for it to be clean. It has to be safe. Imagine you are treating malaria. You're on admission in the hospital treating malaria. Same time, you cannot sleep in the hospital ward because of mosquito.
It's true.
I don't know whether you get it. So
Yeah.
each patient have the right to safe, clean, and secure the environment. Now, there is a part I also want us to pay attention to,
Okay.
which is rare in Nigeria. I think now it's getting better because most hospitals are now hiring private security companies.
Yes.
But if you go to some hospitals, you get to see somebody at the age of 70, 75 as security. A hospital needs to be secure.
Yeah.
If you watch Western World, you can see somebody can just sneak into the hospital and, like movies, and maybe choke a patient to death and everything. A hospital needs to be very, very secure. It's your right. It's not just somebody that will be there to open gates and close gates.
Mm.
So you have the right, when the place is not secure, you have the right to ask the doctor, I don't feel safe in this place. You have the right to air out your view if the place is too dirty. You can't be in a hospital with 10 wards or 15 wards and you're having only one cleaner.
Mm.
Why somebody will be at the end throwing up, the place is dirty? No. You're supposed to feel safe. It also helps you to be free from infection, especially places where they do surgeries. So that's your right. You have the right to secure, safe, and clean hospital.
Yeah.
And if it's not given to you, you also have the right to ask.
Okay.
You have the right to be treated with dignity and respect. If you go to some hospitals, they have wards according to your social status, according to your stratus.
Yeah.
People with little money have their own ward. People with bigger money have their own ward.
Yeah.
And it might amaze you to know that if you go to some of these hospitals, those in the bigger ward, in quotes, tends to get respect, good service from the ward attendants, sometimes the nurses and the doctor. All these people are patients. Forget their social status and everything.
Mm.
They are entitled to the same service, dignity, and respect.
Okay.
Every patient should be treated with that. However, to balance it, a patient also must not go about shouting the service provider.
Okay, so that's where the patient's responsibility also comes.
In.
Yeah.
But attending to these people, you get to see that some people are irrational, maybe reacting to one medication or the other. Some people are finding it difficult to talk. It's not an avenue for you to mock the person because the person is either poor or the person is old.
Mhm.
And the person is also not having money. Both rich and poor should be treated equally with respect and dignity. It's their right.
Okay.
Sometimes, maybe for privacy's sake, you see some places are secured because of the rich, but services should be flat. The comfort might differ, but the respect, the dignity should be same.
All right.
Then we have the right to emergency care. I know you have plenty of questions here.
Yeah. Plenty. Whenever you go to the ER, anyway, ER here they will say trauma and accident and emergency.
Yes.
So let me listen to you first before I ask the question.
So you have the right to emergency treatment
Yeah.
as a patient and as human and as a Nigerian.
Okay.
If you are rushed to the hospital, either accident, you are supposed to be stabilized, even without money. But in question, this service can only be given to you lawfully, one, and based on what is available in that facility you are rushed to.
Okay.
You don't take somebody who is sick or who has an accident that needs an oxygen to a hospital who doesn't have an oxygen, and you say your right is that they must provide emergency treatment, so they must give the person oxygen.
Mm-hmm.
Then another issue is the treatment of people that sustained injury through gunshot and asking of police reports. They are saying,
Yes, now because I know that has been, even though the federal government is trying to adjust that. Even accident victim, they'll tell you must bring a police.
Okay. The 2017, the Safe and Proper Care of Victims of Gunshot Act in 2017, Section 1 said it clearly. You see, every hospital in Nigeria, be it private or public, has the obligation to treat victim of gunshots with or without police report.
Okay.
However, immediately the patient is stabilized, the hospital management should reach out to the nearest police station for proper investigation.
Okay.
So, they need to be given proper treatment to be stabilized. Because this is a medical situation. 2 minutes is enough for somebody to lose his or her own life.
Yeah.
So as they are bringing the person, we are not advertising free medical care, but let the patient be stabilized before we talk about money. So you have the right to emergency treatment, collapse, seizure, blood, transfusion, and all. You have a question?
No. Since that 2017, a federal government act has taken care of it. But I know I've not taken a gunshot person to the hospital. I've gone there for emergency to take a patient. And I know we still had to be running up and down to try to provide what is needed for the patient who even had an accident. The emergency care was not given. So I'm just learning it that I would have taken action then. That's why I'm nodding my head.
Okay.
Yeah.
You also have the right to relevant visitation
Okay.
once you're on admission. But however, this right to relevant visitation does not give a patient the right to bring in all his or her family members always into the ward. This is done within the rules and regulation of the hospital.
Okay.
And sometimes when the patient is in critical condition and does not need visitors, the hospital have the right to say, look, hold on with the visitation. And some hospitals have rules like you can't have more than maybe 4 or 5 visitors. All these things are put in place so that the hospital place will be seen for people who are ill and seen for other patients. But however, you are entitled to proper visitation from either family or loved ones.
Okay. Yeah, before we continue, it's like we are running out of time because the discussion is very interesting and very educative. Under the bill, does a patient have a right to refuse medical procedure?
We are coming there. So, since you've jumped to that place,
Yes.
let's go. The patient have the right to refuse or accept treatment.
Okay.
Now, the patient that will refuse or accept treatment must be somebody who is above the age of 18 and somebody who is of sound mind.
Okay.
Somebody who is above the age of 18 and who is of sound mind has the right to refuse or accept treatment.
Okay.
I'm a Christian. There are some set of Christians who don't accept blood transfusion.
Yeah, exactly.
Now, in such situation, the doctor only have the right to convince the person that this is good for you. But the person also has the right to refuse. At that point, if it's critical and will lead to loss of life, for the doctor's job to be secure, the doctor has the right to document everything the patient has said. Let it be written and signed that I cancel this person for so treatment and he or she refused. And in this place, let it be known that the Federal Competition and Consumer Protection Commission, we don't regulate doctors. The Medical and Dental Council regulates doctors when it comes to professional misconduct.
Yeah.
Then when it comes to facilities and public hospitals, the Federal Ministry of Health takes care of that.
Yeah.
what FCCPC focuses on is the way in which patients are attended to under this bill.
Okay.
And 2026, April to be precise, the Federal High Court in Abuja has already affirmed as well the Federal Competition and Consumer Protection Commission to take complaints from patients because they are consumers and investigate. But that does not mean we regulate the hospitals.
Okay. Yeah. So all the FCPC does is to protect the patient as consumer of healthcare
Yes,
services.
because they are consumers.
Yeah.
To make sure they are attended to avoid overbilling, their rights are respected.
Okay. Yeah, so for every patient, next when you visit a health facility, try to look out for these key rights that has been mentioned. And if there's any violation of these rights, the Federal Competition and Consumer Protection Commission is there to listen to your complaint. But in as much as you have the right, remember you also have a responsibility as a patient. So to round it up, what message do you want the patients to take from this our conversation? What key message?
Okay, what I want patients to take from this our conversation before you lay a complaint in FCCPC, please kindly make an effort to reach out to the hospital first for redress. If it cannot be done within that hospital, before you lay a complaint.
Okay.
Then what I want them to know is every patient have the right. The fact that you are a patient does not mean your right to safety and your human right is out of place. Once you are not treated or once this your right is overlooked, you also have the right to seek redress, which is the last right. And thank you so much for your time.
Thank you very much for giving us this information. The Consumer and Business Education Officer of the Northeast Zonal Office of the FCCPC.
Thank you.
Mr. Abochi, Stephen, thank you for coming thanks for those explanations.
You're welcome.
Thank you very much. You've been watching Your Money, Your Right, a program by the Federal Competition and Consumer Protection Commission. That's from the Northeast Zonal Office with headquarters in Bauchi. And I hope we've learned much about the Patient's Bill of Rights. And for more information, you can contact the Commission and get more details to fully understand what is contained in the Patient's Bill of Rights. From me, Elizabeth Ka, I say thanks for watching. See you next week for another interesting package. Bye for now.
The game is changing, consumers are winning, businesses are serving, every consumer needs. Oh, yeah. Oh, yeah. Oh, yeah. FCCPC.